Hello, this is Dr. Kevin Tomassini from Spinal Performance. You might be having some low back pain and you might be thinking, well, the pain is coming from a slip disc or a herniated disc. Well, actually it might be coming from your sacroiliac joint. So what's the sacroiliac joint? Well, it's a joint right here that is composed of the sacrum, the base of your spine, and the ilium, these bones right here on the pelvis. Usually this happens when the joint is hypermobile, it's moving too much, or is stuck, it's not moving enough. This happens when the joint is misaligned. One side is higher than the other one. That's called lateral pelvic tilt. I have a video about that. So subscribe to our channel, check our videos so you can know more about this and how to fix it. Or your pelvis is rotated. One goes back, one goes forward, or it goes forward like that. That can lead to inflammation on the joint. That can lead to tension on the muscles, sometimes even some pressure on the nerves. Okay? How to differentiate this? Well, usually the pain is around this area right here. It can go a little bit up to the lower back. It can go to the bottom, the groin, and it can go down the leg. Usually this doesn't go below the knee. So that's how you can differentiate if it's slip disc or if it is sacroiliac joint. Sometimes we take x-rays, but most of the time we take posture pictures and see how is your pelvis is aligned by assessing your posture. If it's one side that is higher, and see how it's moving. If we take the x-rays, we're going to see the balance of the pelvis. We're going to see the joints around this area right here. If the joint is too wide, that means that there's some inflammation in that area. Now, I will teach you how to assess it at home and what exercise you can do to improve this condition. Okay, so this pain is really common in people that sit for long hours and cross the legs, or sit on their wallet, crossing the legs. That will misalign the pelvis. Pregnant woman, when you're pregnant, the ligaments get a little bit lax, so that's going to cause some hypermobility on the joint. If you sleep on your side and don't put a pillow between the legs, that will rotate the pelvis. And if you're a runner and you're running or walking and you have a misstep and you have an impact down up to the leg, and that can have an impact on the sacroiliac joint, that can lead to some inflammation. So how to assess this at home? Well, let's do it. So the first thing that you're going to do is you're going to go to the bed and you're going to lay down on the edge, and you're going to bring one knee to your chest, keep the head on the bed, and then bring the other leg down on the side of the bed. If that recreates your pain, that's a positive test. If I do this with my pants, I probably break my pants, so I'm not going to go too far. So just like that, you get the idea, okay? Let that leg hang off the bed and then try it on the other side. Another test is you go on your side and have somebody press on your pelvis. If that recreates your pain, that's a positive test. The next one is this one right here. You're going to put the leg like in a figure four, like this. You're going to stabilize one side of the pelvis, and then you're going to push down on the other leg. If that recreates your pain, that's a positive sign. Try on the other leg as well. So stabilize the pelvis, then push on the other one and see if you have any pain. So those are 3 tests that you can do at home to see if you have this condition. So the first exercise is called the pull push. You're going to do this laying down at the floor or at a firm surface. And what the idea here is an isometric contraction of the area, okay? So you're going to bring one knee up, 90 degree here. See that my leg is straight down, okay, 90 degree here on the hip. And you're going to push with your leg that way, and with your hands, you're going to pull back. So this is called a pull push. So go here, and again, with your leg, you push that way, with your arms, you push this way. And you're going to hold that contraction, push with moderate to hard force right here. Hold that for 3 to 5 seconds, then relax and pull your leg as high as you can. Do this with loose clothes, comfortable clothes, so you can have more range of motion. Don't do it with tight pants or something like this, because you won't have a lot of range of motion. Then alternate, do it on the other leg, okay? So bring the leg, push that way with your knee and this way with your hands. So hold that 3 to 5 seconds. This shouldn't cause any pain. If it's causing pain, don't do it. And then relax and pull your legs as far as you can all the way, and then do it on the other side. Do at least 3 to 5 repetitions in each leg, always alternating. That's the first exercise. Now for this next exercise, you probably will need a band foam roll, or a ball, okay? And what we're going to do here is go out, hold it for 3 seconds, and then go in. With the bands, we're going to go out. So you can put the bands around your legs, okay? Like right there, okay? And you're going to lay down and you're going to push out, okay? Try for a band that is not too loose or too heavy. So the main thing is that you have resistance. You don't want to go all the way out. You want to have some resistance. Hold that for 3 seconds. And then with a foam roll, you can put it around here. You push in, okay? You can do this with a foam roll, or you can do this with a ball, and you can push in. So out 3 seconds, in 3 seconds, okay? The best thing that you can do, best way that you can do this is laying down, facing up, okay? So go out like this, hold it for 3 seconds, then go in and hold it for 3 seconds, go out 3 seconds, go in 3 seconds. You can do this 10, 15, or 20 times out and in. You can do it sitting down as well if you have a big belly, if you're pregnant or something like that. It's better to do it laying down, but you can do it sitting down as well. So pull, push in, and pull out, holding it for 3 seconds. Okay? So that's the second exercise. The third exercise is the deck buck. So again, lay down on a hard surface or firm surface. You're going to put your legs 90 degrees here on the hip, okay, straight line here. And now you're going to straighten one leg as far as you can. Go back and do the other one. If you feel pain, usually it's when you go down. Don't go all the way down. Just go to where you feel the pain and then go up. The more you do it, the easier it's going to get, and you're going to be able to reach a little bit farther away. Okay, so go like that. Make sure that you're engaging your core and your low back is flat on the floor, and then you just go boom and boom. Okay, really simple. The next exercise is going to bring the pelvis as well. It's going to move the pelvis. So if you're going to do this side, you're going to be stretching the psoas muscle. This muscle goes from the low back to the front of the hip. Okay, and what you're going to do is just boom, go like that. Just feel the stretch around that area. That is going to move the pelvis as well. Okay, so boom, hold that 10 to 15 seconds, and that's going to help with that condition. So there you have some ways that you can assess this condition at home, that you can do some exercise at home. If you still feel the pain and it's not going away, go to a professional, go to the chiropractor, go to the therapist or your osteopath, and check this condition. You might need an adjustment of that joint. You might need some other exercise. Again, this is Dr. Kevin Tomassini from Spinal Performance. Subscribe to our channel, like our videos, and share. Have a great day.